Wow, I was fascinated by the Martinez family therapy session. So definitely there is so much we can do to help this family. So today in this video we're going to be talking about structured family therapy. Structured family therapy was mainly influenced by Salvador Minucci. Let me tell you a little bit of this kind of therapy. This kind of therapy, it is as the structure said, it is a structure. So if we can think about structured family therapy and how it functions, I like to think about the structure of a house. If something is going on in the structure of a house, there is a high potentiality that the house is going to collapse, right? Same thing happened with a family. A family has to have a clear structure or a map that the family can follow. Otherwise, we are going to get lost within the problems, within the conflicts, internal conflicts that we have. So if there is not a structure, there is great possibilities that the family is going to collapse. So Minucci come up with this idea that the structured family, it is important for the family in order to be successful. There has to be a structure. He looked into three factors: a family that has boundaries, a family that has clear hierarchies and subsystem, and have clear goals, have a greater potentiality that they're going to succeed, or they're going to be able to overcome the problems that they do have. So we see that in the Martinez family, Dr. Grande, he's in the chair and he's asking questions about the family, want to know what's going on. We have Anna is the daughter, Tracy is the mom, and Charles is the dad. For what I can see, the problem in the family, the conflict is that Anna has been arrested or warning. She was given a warning because she was caught up drinking alcohol. And I can see Dad being more permissive, more understandable, more flexible, and feeling more empathy for Anna. He's like, oh, come on, I was at one point of my life, I was there. Why should we be so strict on her? And the other side, we have Tracy. Tracy is more strict, more rigid. And Anna says, oh, you're a complainer. So that's how they title mom as a complainer. So we see this argument going on among Tracy and Charles. I can see that Charles, as he says, he spent most of his day working. Mom is in charge of the house and the cleaning. It seems like she feels saturated and she feels that she's not being validated. Charles is the one that's supposed to be in the top hierarchy because he's the dad, and according to Saul, he stated that the hierarchy is that, there should be a clear hierarchy, otherwise the house is not well structured in the boundaries. We can see that Anna is crossing some boundaries, that she was probably allowed to cross those boundaries, not when she became a teenager, but it was probably earlier. And now that she's a teenager, those boundaries have been crossed very clearly, so it is making it more difficult for the family to deal with. Now I see the conversations among Charles and Tracy where it seems to be that they are distanced. They are distanced. Charles says that Tracy should be doing her job as a mom better than the way she's doing it. Tracy feels that she's doing a lot more, but still feel that Charles is not involved in the relationship and as a parenting. So we can see that lack of trust maybe among each other. We can see the boundaries being crossed. We see the lack of hierarchy. We also see the subsystems, right? The subsystems are definitely being playing a big role in here. The goals, what is the goal? Cheryl has one goal, Tracy has one goal, and Anna has one goal, and it seems like she's the only one that is actually being successful with her goal, which is having some independence in where she can do whatever she wants, and she's actually doing so. She has a better, clear goal and a better way to achieve it for what I can see. So let me see what else I have here. I see that Anna mentioned that she feels like she's always criticized by mom instead of being accepted. She's always saying something about me, something of what I do. And mom says, well, you're a child and you're drinking, you're not an adult. And it seems like as Anna, as mom mentioned, I cannot make her understand nor make dad understand my point of view. So they both have different point of views, and because they're not into an agreement, it is allowing them to grow apart and create a chaos in the family. So they definitely will benefit from having a better structure and within their relationship. So let's see, explore the boundary systems. That's what I mentioned. There is some coalitions among dad and mom, the subsystems. Some of the patterns that I see here is the arguments among dad and mom that is taking them nowhere, and because they are not in agreement on what exactly they want to take, their how to evolve within their role as parents. Anna sees this. Well, she's pretty much this is kind of allowing her to do whatever she wants. Yeah. The dysfunctional patterns, those are already mentioned. The boundaries as well. There is no boundaries. Seems that Anna doesn't have the respect that mom wished she had towards her. I don't see that there. But there is some sort of respect, but the communication seems like Anna feels more attached to dad because dad understands her better than mom does, right? If I would be their therapist, some of the strategies that I will use first, as Minucci mentioned, I will make sure that there are clear boundaries, hierarchies, and subsystems, and the goals are clear. So I will provide guidance as I see there was something that I would have done, and I didn't see Dr. Grande did, is that I will make sure that when mom and dad are having this conversation, Anna will not interfere. Or when mom and dad are having this conversation, dad does not interfere. So we can allow them, or we can give them time to have this conversation among them. I will probably ask some to do some enactments. As mentioned in the book, enactments involve having them begin the engagement in the conflict, in which we can help them structure or restructure what they had, what we see in the house. So we see this conversation right among mom and dad, and that actually, like how Dr. Grande said, and asked Anna, so this is how things are in the house. And Anna stated, yeah, that's why everything in the house is a chaos, so I'd rather do whatever I want. So definitely I would do some enactments within the therapy, and make sure that if there is unmatched boundaries, we can assess some problems, and we can even reassure or ensure that the conflicts or the intervention is more clarified in regards to boundaries. So let me see what else would I do. So throughout the session, I will continue to prompt the family and guide the conversation so it is more productive rather than conflictive. Absolutely, something else that I do love about structured families is the mapping. And I don't see the mapping here in this chapter, but I feel that having genograms and showing this to the family will definitely they will benefit, because in the genograms we will see the mom, the dad, and the daughter. They did not mention if Anna has any siblings or who else is in the living in the family, but create this genogram and help Tracy and Charles identify who actually is not who is more than the other, but at least they have to be in agreement. We have known that dad is the head of the household, right? But sometimes I do understand dads are not ready for that role. Nonetheless, I will encourage them to have couples therapy, while we also continue to do the families therapy, so we can create clear boundaries among them as well. I will also increase the engagement among mom and dad, because it seems that mom is just in charge of the household, while dad is in the house. Seems I can feel the mom's frustration and anger because she feels that no one is helping her. Dad comes home and he's not doing nothing else because he supports the house. He doesn't supposed to come and do the dishes and do the cleaning. So definitely I will make sure that there is also more engagement among both, and maybe having some dates where they can go out and have the opportunity to dialogue and see how they can get closer rather than apart, and help raise and improve pretty much the parental hierarchy among the family. So it is like building alliance instead of them being the fighters, because then we're creating this triangle among Anna and her parents. So if we create or build some alliance between a mom and dad, so now they can work together as a family. So we can accommodate their styles. And so as I said, doing the mapping, doing the hierarchy, addressing the problem, what exactly is the underlying problem, because they come to therapy because Anna was caught drinking under the influence of alcohol. But we can see that that is what we see on the surface. So we need to find out exactly what is going on under the surface, which we can see that it is the relationship mom and dad and their world view, the view of the world is affecting how they get along with each other. So in regards to the subsystems, we will make sure that we achieve the structural goals. Some examples will be that making sure that within those boundaries, what are the strengths boundaries, so we can also avoid cross-generational coalitions among mom and the child. So let me see, what else can we do to help the family. Goals. Make sure what are the goals. The goal is Anna. They want Anna to stop drinking. That could be just one goal, but it doesn't mean that is like the ultimate goal. I believe the ultimate goal is for them to have a better way to communicate and to have a better structure. That's the goal of structured family. So let me see the interventions that I will utilize so I can help the Martinez family is the enactments, which I will encourage them, which actually is probably pretty much what Dr. Grande encouraged them, right? To enact whatever happens in the household to show it within the therapy session, so he can get a better picture of what is going on. Now, within the enactment, as a therapist, we have the opportunity to help them create these roles where the boundaries are more clear, and we can redirect them, we can role play, and we can encourage them to to reframe what they're already saying, but in a way where it's not offensive to other, and it is, but rather more understanding, more way, a better way of communicating with each other. Within the enactment, will be redirecting the problems. Redirecting the problems or redirecting the way that they're communicating. We can do interrupting if they are. We can see that they are raising their voices, or if they are getting out of topic, or they are bringing the past to the present. If they are not doing eye contact, so we can always interrupt the conversation and redirect the situation, so it gets kind of like towards the route we actually want them to go to. A lot of systematic reframing, definitely lots of systematic reframing is very recommendable to do it, so we can kind of put those pieces together and reframe what is going on in a more systematic and dynamic way. So reframing. So we will be doing the enactments, the reframing, the interrupting the patterns, per sure boundaries. Creating and defining exactly what is the boundaries, so they know where to cross and when to stop. Hey, you don't cross this line. I am your mom, kind of thing. And of course, something that I really like is challenging the family's world view. As we can see, and I know I make some notes here. Mom was saying, "I feel alone. It crushes me. It crushes me that I don't have my husband so poor. So I have all the responsibility in the house." So this seems to be that this is her worldview, and that worldview is crushing her, is putting too much stress on her. And who can live under stress 24/7? No one. Stress is good, but no in a high proportion. So if mom is stressing, maybe she's not, because even though I do agree, right? As a mom, I do agree, and I don't want to be biased. Hey, you're a child, you're a teenager, you don't supposed to be drinking. But there is probably better ways to approach, or different ways to approach. Uh, um, but because she doesn't have that support, definitely is crushing her. So we can challenge unproductive assumptions by questioning and in an operational way. So challenging the family worldview is definitely something that I will use to help this family overcome the current problems that they are going through, and much more that I could be using. But I think for the moment, those are all the techniques that I will be using, that I would love to use to help the family, the Martinez family. And yep, that's it. And I hope you were able to kind of get a better idea or a better understanding of what I'm sharing about structure family system, which is really, I really get fascinated by this kind of therapy, and looking forward to apply it with my potential clients. Bye.